I am Dr.Surekha.A, Director of Apoorva Center for Maternity Care, Medipally. Today we are going to talk about the scans that are done during pregnancy. It is not always necessary to do repeated scans as we sometimes see in our clinics. Women come with so many scan reports being done on every antenatal visit, but this is absolutely not required. The first scan that is usually indicated is the viability scan, and this is done around 6 weeks of pregnancy. A viability scan is also not a must, but it should ideally be done for all women who do not have regular cycles or who have a previous bad obstetric history or a previous history of ectopic. The second most important scan is the NT scan, which is usually done between 11 to 13 plus 6 weeks. And this is usually combined with the first trimester screening tests, wherein the data that is obtained from the tests and the ultrasound report are incorporated into the software, and then we get in the risks of having a chromosomally abnormal fetus. The third scan that is important is the TIFA scan, that is an anomaly scan, wherein a detailed anatomical survey is done and we check out to see if there is any physical abnormality. The next scan that is usually done around 32 weeks is a growth scan. Growth scans are usually not indicated earlier unless there is an indication to do so, which may be a woman with a high risk factor, a medical complication of pregnancy, or if the obstetrician finds that the symphyso-fundal height is not corresponding to the gestational age. And this should be the discretion of the obstetrician to decide whether a scan is indicated at 28 weeks or at 32 weeks. So after 32 weeks, another growth scan ideally is not indicated, but again this should be the discretion of the obstetrician based on the clinical and medical condition of the patient. The other scan which may be done in some high risk women is an echo, which is usually done between 22 to 24 weeks, wherein a detailed cardiac survey of the fetus is done in order to check the proper anatomical formation of the heart. This is usually indicated in women who have diabetes or women with heart disease or any other risk factors. So ideally these are the scans that are indicated, and if you have any doubts regarding any of these ultrasound scans or any other information regarding the same, kindly call us at the below given number. Thank you.